The American Heart Association is making nutrition security a high priority issue in 2021. I'm joined today by Lavonne Pledger, an advocate for food access and security, as well as a personal trainer, and Chelsi Bennett, a Virginia Government Relations Director for American Heart Association. It's wonderful to see both of you. Thank you so much.
Thanks for having us.
Morning. Yes. Good morning.
Good morning to both of you. It's such an incredibly important conversation. Chelsi, let me start with you and ask a little bit about nutrition security and nutrition security policies that are critically important work for the American Heart Association.
Yes, and as you shared, I am honored to serve as the Virginia Government Relations Director, and in my role, I handle the state and local policy for the American Heart Association. This year, as we look at our 2021 public policy agenda, both at the General Assembly and locally, nutrition security is at the top of the list. And the reason why is because COVID-19, the pandemic, has really shown us where there are gaps in our food systems and the need for not only food access, but nutrition security. Here at the Heart Association, we want to ensure that all Virginians have access to nutritious fruits and vegetables. And so there are two main policies that we're working on at the Virginia Legislative Assembly this year. And the first is the Virginia Food Access Investment Program and Fund. This program and fund was actually passed in the 2020 session, and it received an initial appropriation of $1.25 million. The purpose is to provide grants to retailers who offer SNAP so that we can increase food access in underserved communities, as well as the number of SNAP retailers. And this year, we're asking for more funding, $4.75 million, because we know that there's a need. Our food insecurity rate here in Virginia increased to 13.1%. Our second top priority is the produce prescription program. This is a new piece of legislation that we introduced this year that's being championed by Delegate Dolores McQuinn, who also championed the food access bill along with Senator Jennifer McClellan. With the Produce RX prescription program, we are looking to start to be able to offer produce prescriptions to CHIP and Medicaid patients, so that as we look at food insecurity, we're also looking at those who have chronic illness, and we can help with both of those issues through this policy.
The synergies created by these policies coming online and being funded are really making all of the difference. Lavonne, I want to talk with you. You're down in the Hampton Roads region. You and Chelsi have worked together, communicated. You're a real world example of noticing right in your community the essentially creation of a food desert. Talk us through the response that you had in that situation.
Well, I got to say, it was pretty shocking when our grocery store closed. It came out of nowhere, right smack dab in the middle of June. The only grocery store that, people had walking access to in my community closed. And it was the only place that people could get, fresh fruits, veggies, lean meats, protein, things like that. And it's gone. And it's pretty crazy in the middle of a pandemic when people are losing jobs. I personally experienced job loss during this, this whole situation. People are supposed to be locked indoors, and now we don't have access to food. And it was impossible to try to figure out what the next step was. So it's important to have, legislation and things in place so that, that we can continue to, fight chronic obesity through our diets and the things that we eat and the things we put in our mouths. Like, I am a firm believer in, I eat what I am. So I am what I eat. And if I don't have access to the things that keep me going or keep my body, nourished and properly functioning, then I can't be successful. And it's very important to have in a neighborhood like mine, where we have limited access to just about every resource you can think of, where there's healthcare disparities and people can barely get to work. Not only that, have to figure out how we're going to feed ourselves. It's definitely a real thing that we have to deal with here in my neighborhood and many neighborhoods like mine. And it's all over the country.
Exactly. I was going to say, this is a real world experience that you're having in your community, and it's replicated in communities across the Commonwealth. So thank you for taking action. You put a plan into action where you began repurposing a school bus, which became the cool bus, to bring fresh fruits, vegetables, and help ensure nutrition security into the community. Chelsi, thank you for all of your hard work in making an impact with what you do.
Thank you. It's because of Virginians like Lavonne that my work continues, my passion continues, because they need a voice at the General Assembly, and grateful that Lavonne is there right alongside to share his personal story as a constituent to the legislators.
Absolutely. Lavonne, a father of two, personal trainer, and you're right. It is so important to make sure that we have access to the good, fresh food, nutrients, and vitamins. Thank you so much for everything you've done, Lavonne. We appreciate you.
No problem. Thank you for having me today.
My pleasure. It is February. That's Heart Health Month, and this is definitely very closely correlated. We're going to share some information about this very important topic on our website, WTVR.com/VTM, so you can learn more.
If you want more information on the American Heart Association and these important programs, visit heart.org. And we hope to see you on the other side of a quick break.